Let's talk about how to support patients with headaches. So we talked about St. Johns Wort briefly. Well, St. Johns Wort were also found to relieve migraine pain in animal studies. The possible mechanism is by inhibiting nitric oxide production, which causes changes in the vascular function and changes in blood flow. Changes in vascular function, which means that it's either dilating too much or contracting, is associated with headaches and migraines. Reduce depression and anxiety, as we mentioned, inhibit the expression of pro-inflammatory genes such as cyclooxygenase 2 and interleukin 6, right? So there is a theory also that migraines are caused by an inflammatory reaction, and this might be one of the mechanisms of St. Johns Wort reducing headaches by reducing inflammation as well. Another herb that could be useful for headaches is Feverview, which belongs to the daisies family. It is reported to have anti-cancer, anti-inflammatory, cardiotonic, and antispasmodic properties. The most important biological active compounds are the sesquiterpenes, lactones. The main one is called peronilides, which is found in the superficial leaf but not in the stem. Now, why am I mentioning this? Because with some products, some vendors might use a particular part of the herb that there's no studies on, and we don't know what's the effect of it. So what do? If you don't know which part of the herb is most effective. I'll give you an example of a recent prescription recommendation that we did. When you don't know which part of the herb, for example, ginkgo biloba, that we were considering for a patient with poor memory, right, or decline in memory. We found when looking at the research that the leaves could be beneficial and other parts of the plant could also be beneficial. So what we recommended that patient is to get an extract that includes the entire plant. So you can find those extracts, and those will typically include all parts of the plants, and that would be my recommendation. You can find those as tincture, you can find those as capsules or tablets. And typically manufacturers will put in, the term for it is full spectrum. So full spectrum herb means that the manufacturer use all the parts of the herb, or that tincture or product contains the entire spectrum of phytonutrients that are included in the plant, right? So that's one of the ways to know that you're getting basically majority of the benefit from that plant. Feverview found to inhibit contraction of blood vessels, inhibit histamine release, which is great for patients with allergic or inflammatory reaction, and reduction in inflammation. Long-term consumption is needed between 3 to 12 months of use, found to prevent or significantly reduce attacks of migraines. Again, remember, some herbs studies show that 4 weeks is a good timeline to start seeing results or notice reduction in symptoms or change in symptoms, while other herbs require 3 months and Feverview requires 3 to 12 months. So it's really going to be taking a longer time. Typically with headaches, we tell patient in advance that it will probably take about 6 months on average to see results. They're probably going to have some benefits from before that, but they have to be very persistent with their treatment. Effectiveness reported with powdered leaf extract, but not with alcohol extract. So again, you can see how using a powdered leaf in a capsule form is going to be more therapeutically effective than alcohol extraction. And this is exactly why you're taking this class, because we're actually reviewed all the studies for you, and we're telling you exactly which part of the plant or which plant going to be more effective for a certain condition. Now, the dosages are 100 milligrams to 300 milligrams, up to 4 times a day, and we want it standardized to contain 0.2 to 0.4% of parathenoids, right? The name, by the way, Feverview, stems from the Latin word febrifugia, which means fever reducer, right? So just really interesting to learn about herbs. Another herb that is helpful is Butterbur, Pedicides hybridus root, and it was effective in reducing migraine attacks by 48% at 75 milligrams Pedicides extract, and that was 75 milligrams twice a day of that extract. 50 milligrams twice a day was not more effective than placebo. When patients sometimes come back and they said, well, I tried this herb, it didn't work for me, one of my questions would always be, have they taken it either in the right dosage, right? For example, this particular study is showing us, that was published in 2004, showing us that at 50 milligrams, it wasn't effective, but at 75 milligrams twice a day, it was effective. So just that extra 50 milligrams a day was what did a major difference by reducing almost half of the migraine attacks with patients. Another question that we always want to ask ourselves is, have you taken this long enough to notice the symptoms, right? And again, that could be 4 weeks, 12 weeks, or sometimes even 6 months to see those benefits. Vitamin deficiencies might contribute to nerve damage and dysfunction. I wanted to mention that because, for example, B12 deficiency that is more common in vegetarian and vegans, but also patients that have anemia or older patients that their absorption has reduced, even patients that eat meat, chicken, fish, other animal protein products might have lower absorption of B12 because of the intrinsic factor that is being reduced as we age or due to damage to the stomach. That might lead to neurological symptoms such as numbness or tingling, depression or anxiety. So always remember that when we talk about headaches and nerves, either central nerve system or peripheral nerves, we want to make sure that the patient has a consumption and absorption of those nutrients. Herbs to support headaches. Another one is sage, which is recommended for relief of unilateral headache and headaches with neurological origin. It contains carnosol and uracilic acid that appears to contribute for the anti-nociceptive effect, right? So it means that it's blocking sensation of pain longer by using sage. One of the active ingredients called salvigenin demonstrated an analgesic effect like morphine. So this will be great for patients that might have either other neuropathies or nerve pain like sciatic pain, right? Not just headaches. The dosage is 500 milligrams of sage extract per day and up to 1 gram in some clinical reports.